My name is Dr. Harsha Kariyawasam. I'm a consultant in allergy, medical rhinology and respiratory medicine, and I'm the founder of the London Nose and Sinus Clinic Medical. I fell in love with respiratory medicine as a medical student in my final year, where I did a ward round where we went from a patient with cystic fibrosis and infection to someone who had respiratory failure, to someone who had terrible asthma and associated allergic rhinitis and sinusitis. But the key thing that made me fall in love with the specialty were my mentors. I pursued my interest both as a junior doctor and made my way to the National Lung Hospital at the Brompton Hospital, where I had the honour and privilege for working what I call with the gods of respiratory medicine and airway disease. One particular mentor was the late Professor Margaret Hodgson, who was not just a brilliant respiratory physician, but she was one of the most hardworking and kindest people I work with. And what she said to me on the second day of the job was that it's all very good being hardworking and bright and focused and passionate, Harsha, but if you don't have empathy and care for your patients, nothing else matters. And that's very much been the ethos of my practice ever since. I have not just a medical degree, but also a BSc in biochemistry from Imperial College London, and also a PhD from Imperial College London. I was very lucky to be appointed as a consultant at a national teaching hospital back in 2008, and I've never looked back since. I'm very, very grateful to be here. It's through hard work and passion, but also because I met the right people who gave me not just incredible training and drive to pursue the disease, but also taught me that nothing matters other than a smile and care for the patient, along with excellent clinical care. My approach to patient care is really based on making patients feel welcome, valued, listened to and respected. I very much want patients to feel empowered, that they understand why we did something, what the result means, the implications for them to be involved with their treatment choice and care, and to contribute to decision making so that we as a team, both the clinical team and the patient, work together to lead to getting better, and not just getting better, but staying better long term.